just press. I don't know if it's all set up before. Hello, everybody, and welcome to our first network webinar. Thank you so much for joining us. We've had some apologies from some schools and Healthy School Scheme coordinators, but we're going to be storing this webinar on our website so that they and any of your colleagues who you think would be interested will be able to catch up at your leisure. So today, this is the programme that we're going to follow. We're very lucky to have Dr. Becky Langford, who is sitting next to me, and she's going to be talking about school health promotion, reviewing the evidence and making connections. And then there will be an opportunity for people to comment or to question, and then I'm going to finish with some network news. So if I can just introduce myself for those who haven't met me, I'm Joan Robertson, I'm manager of the School Health Research Network. We have also joining us in the room, and you will possibly hear from them later. We have Adam Fletcher, who's senior lecturer in Cardiff University, based in Decipher, Gillian Hewitt, who is the researcher on the network, and Cheryl Briscombe, who also works on the network. And then we're ably being helped by Mike Rudge, our IT person. So that sort of makes up the team here. So the rest of you obviously watching in. So we're going to just talk about the sort of the logistics of it. So this is the screen you should be seeing from your computer, except for the bit in the middle. So we will just talk you through some of the things that will enable you to join in. So at the bottom left-hand corner, that's just lit up. That shows you who you can share your comments with. So if it's a technological question, Mike Rudge is the person you want to share it with. Otherwise, you can share with everyone or the presenters. And then at the end of Becky's presentation, we'll actually open up the microphones. So if those of you who've got a microphone will be able to speak and ask questions, but otherwise people will still be able to type questions there. There is one facility on this that might be helpful, and if you go up to the top of the screen and click on more, it gives you additional options. And if you press on take meeting notes, then your screen will change from looking like that to looking like this. So you'll write any shared notes, comments to presenters or anything else in the top. Your private notes you can write there, and as soon as the webinar is over, those private notes will be sent only to you, whereas we'll all get the shared notes so that we can record what we're talking about today. So just at the very end, I just want to mention there's going to be a very quick evaluation which will actually replace the presentation on your screen. And obviously, because this is the first, we'd really welcome any comments and value them for any future use of a webinar. So I'm going to start by just asking Becky if she'd like to give her presentation. She's based at Decipher in Bristol, and we're really glad to have you here.
Thank you very much, Joan. It's a real pleasure to be taking part in the inaugural webinar of the network. Joan's asked me to come and talk today about some of the pieces of research that we've been doing around school health promotion. So what I'm going to talk about today, I'm going to start off by looking at the evidence for the effectiveness of health promotion work in school, talking about a big review that we've been doing. Then I'm going to talk about some qualitative work that we've done with teachers in the Bristol area. And in the middle of this, you're going to have an opportunity to have an interactive moment, as long as it all works, which I'm sure it will.
We'll look at Mike.
We'll look at Mike. He'll be making it work, I'm sure. Where we're just going to give you an opportunity to tell us what you think. And then at the very end, I'm going to talk about some of the views from students on a consultation that we did at the end of last year. Okay, so I'm going to start off, as I said, talking about the evidence around promoting health in schools. We've just finished off this very big piece of work looking at the evidence for something that's called the Health Promoting Schools Framework. Now, I'm sure that's probably something that you've not heard of before, but essentially it's very similar to the Healthy Schools Programme. And in fact, the Healthy Schools Programme kind of came out of this idea. So the Health Promoting Schools Framework was an initiative that was set up by the World Health Organization in the late 1980s. And it was very much founded by this idea that there's a relationship between health and education. So as we all know, if you want to be able to teach children, they've got to be in a kind of fit and healthy physical and emotional state. They need to be well and happy to be able to learn well. But it also works the other way around, in that the better educated you are, the better your health is later in life. So there's this really nice mutual agenda between the work that you do in schools and the work that we're doing within health. So the Health Promoting Schools Framework is very much taking this kind of very holistic approach to promoting health in schools and trying to tackle it within the whole school environment. So the types of interventions, the types of research that we were looking at were studies that had had action in the schools across these three different areas. So first of all, these schools had to have some kind of health education within the curriculum in the school. They also had to make some kind of change either to the school's social environment or the physical environment. So that might be, implementing a no smoking policy, or a kind of peer mentoring system to tackle bullying issues, or it might be about more physical changes. So putting in bike sheds to promote active transport to school, or changing the food that's available in the school to make it healthier. And then the final part of these interventions was really recognising that schools are just one part of a child's life, and that any message that's being promoted at school really needs to be backed up by the families and the wider community as well. So that they had to have some kind of engagement with those families and communities outside of the school gate. So that's the kind of interventions we were looking at, very kind of holistic, very whole school, similar to the kind of things that are promoted with the Healthy Schools programme. And we wanted to know whether or not this type of approach actually works, whether it's actually worth doing. So we did what's called a systematic review, which kind of really does what it says on the tin. You systematically look at all the literature. And it's not just UK based, we look at the evidence from across the world. And what we're doing in this review was looking at the very top quality evidence. So we're looking at evidence from what we call randomized control trials, which really are the kind of best way of finding out whether or not something works, where you compare it to a control group. And then you perform some fairly scary statistics and meta-analysis, which I have to admit I didn't do myself. I had a statistician to help me to do that. But the idea is that you pull all of that data together and say, right, when we look at this overall, is it actually working? Is it worth doing this? Is it improving the health of the students? So that's what we did in the review. Now, obviously, we were looking at improving health, but obviously there's lots of different elements to health. So this is showing you what the different studies were focusing on. We found 67 studies that we included in the review. There's just a couple of things I wanted to point out here. First of all, you can see that 50% of our studies were looking at either physical activity or nutrition, or a combination of both. So really kind of targeting that kind of obesity agenda. Then we've got about 7 studies that we called multiple risk behaviour interventions. So that's where it's one programme, but it's targeting a number of health issues within one programme. So that's usually things like tobacco, alcohol, drugs, sexual health, violence. Then we've got a whole wide range of other topics. The one that I did want to highlight, and I'll come back to a bit later on, is the section in red, which is about mental health. We actually only had 2 studies out of the 67 that we included that looked at mental health. Now, it kind of looks that we had the same number for sexual health, violence and alcohol. But remember, those topics were also included in the multiple risk behaviour interventions as well. So they're slightly more represented, still not massively so. But I was really quite surprised at the small number of studies looking at mental health in this age group. So that's what they were looking at in terms of health. Of course, the other side to this intervention was about the idea that, if you promote health, you have an effect on educational outcomes. And obviously for teachers, we would imagine that's what you would be particularly interested in. But as you can see, I can't actually tell you a great deal about that, because of the 67 studies, actually the vast majority of them simply did not record any impact on educational outcomes at all, whether that was, test scores or attendance or anything else like behaviour in the classroom or concentration levels. So although this initiative was really meant to be about the link between health and education, a lot of the research has kind of forgotten that and is missing that out. And I think that's a real missed opportunity. And again, I'll come back to that a little bit later on. So those are the studies that were included. As I said, we did some scary statistics. So this is a forest plot, which is the kind of output you get from when you do a meta-analysis. And it's fairly complicated, and we've produced quite a lot of these. So I am going to be very kind and not go through all of them with you. What I'm going to do is just simply summarize the results for you. Okay, so what we found overall is when we looked at the statistical evidence, we found that the students who were taking part in the intervention schools, so the health promoting schools, we found that they were statistically more likely to be physically active. They had better fitness levels. They were more likely to eat fruit and vegetables. They were less likely to smoke, and they were less likely to be bullied. So really, that's quite positive. You know, some really important health issues that we found that it really does work for. Now you can see that middle section, I've said no evidence of effect for a number of outcomes. And I just want to explain what I mean by that, because no evidence of effect doesn't mean evidence of no effect. We're not saying that these don't work. What we're saying is we just don't have enough evidence at the moment. There really weren't very many studies looking at those topics. So at the moment, we can't statistically say, yes, it works or no, it doesn't. What we can say is that there certainly seems to be a trend towards it going in the right direction and saying, actually, maybe it does work. But at the moment, we can't draw any clear conclusions. And what we really need is a bit more research in those areas, but certainly looking quite promising. And then finally, we've got insufficient data for a number of outcomes. We just simply didn't have enough studies to be able to do this statistical analysis. So it's a bit of a mixed bag, but I think generally overall, it's quite a positive story. It's really saying that the kinds of work that you're doing in schools, actually, they do have an impact. They are improving students' health for certain outcomes, and for the others, it's looking like it's working, but we just need a little bit more evidence. So that's kind of an overview of the evidence on the global scale. But having done this review, I was left with a few kind of unanswered questions, really. Kind of picking up on what I just mentioned earlier, which was about what the research was focusing on, because as I showed you earlier, you know, a lot of this research is focusing on obesity, and then we've got very little on things like mental health, very little on sexual health. So I was just thinking, well, actually, if you went and asked teachers or students what they're most concerned about, would they say obesity or would they say something else? And then, of course, we also don't know how these health issues are affecting learning or whether they do have any impact. So what I decided to do was then follow this up with a bit of qualitative research, asking teachers in the Bristol area what they think about this. So we went and did some interviews with a range of teachers. So they were senior management, healthy schools coordinators, and general teaching staff, to get a wide range of views. And we interviewed 25 teachers from 9 different schools to get their perspective on this. So in a moment, I'm going to show you what they said, but this is where we're going over to our interactive session. So I'm going to hand over to Joan to do this little bit.
Okay, yeah. So these are sort of the 5 topics that we've chosen. They're very broad-ranging health action areas. And if it hasn't already come up already on your screen, we're going to ask you to vote in a poll. You'll only be able to choose one of one of the health areas that is of particular concern. I'm sure you'll find that in your school you might have to deal with all of them, but if you can just vote for one, and then you do that by clicking on the little circle just to the left of the health title, and then we can just see, we should be able to see the vote as people vote. We should be able to see what percentage are voting which way, and it's changing in front of our eyes, so I hope it's changing in front of yours as well. So there we are. So, oh no, it's still going.
It's still going, yeah.
Yeah. So we have, so that's quite interesting then, Becky.
Yeah. So is that all of the votes?
Do you think that's all the votes in? So we've got, so 62% mental and emotional well-being. That's actually quite a big thing. And then bullying and violence and sexual health. But interestingly, that the substance use and then the obesity, physical activity and exercise hasn't been anyone's complete priority.
Yeah.
So So that's an interesting point, isn't it? And perhaps one that might echo some of
so that's really interesting to see. Obviously, we were asking this in interviews so they could go into a lot more detail. We just wanted to see what you thought about that. But that's really interesting. And some of that resonates quite nicely with what the teachers were saying in the Bristol area. So I'll go on.
Yeah, just before Becky goes on, sorry, if you felt that there are particular health issues that are priority in your school, you can actually share that within the shared notes, and it might be quite interesting to see if there are any topics that are particularly of interest.
Yeah, because obviously they're very broad categories.
Yes, they are. So within that mental and emotional health and well-being, maybe there's something that's a particular priority for you. So yes.
Okay, right. I shall continue to tell you what the Bristol teachers said. Let's get that to move. Okay, so very similar to what you said. One of the first things they came up with as a concern for their student population was mental health and well-being, and that really manifested in a number of different ways. So they talked about students being quite stressed out about exams or depression, anxiety, but more commonly they talked about things like self-harm or eating disorders, even suicide in some cases, in some of these, or attempted suicides in some of these schools, but very much a pressing issue for them and something they were very concerned about, and to a certain extent something that they felt that they didn't feel confident in being able to deal with, and didn't necessarily have the skills and experience to know how to address that issue, despite being very worried about it. So that was one of the first issues. Another very common issue to come up was actually a concern about nutrition in their students. And it'll be interesting to see if this resonates with any of you out there. So one of the first things they mentioned as a health topic for these students was breakfast, issues around breakfast, either not eating breakfast at all or having the breakfast that you can see in front of you. So a packet of Quavers and a chocolate bar is a direct quote from one of the teachers. So they were very concerned about that. They're just not starting the day in a kind of nutritionally good state. They also mentioned another nutrition issue, again, which I'll be interested to see if this is an issue in Wales as well. I'm sure it probably is, about energy drinks and the kind of rise of energy drinks in and students using these as almost as a way to get through the day, and drinking them on the way to school, at lunchtime, after school. And you'll see the effect of that later on in a quote that I'm going to give you. Okay, so that was the nutrition side of things. They did talk quite a lot about substance use. This was quite interesting. I thought most of the teachers actually felt that smoking and then also drugs were not really a huge issue in their schools. They were seen as very much affecting a small minority of students, but actually generally smoking rates, they felt they'd declined over the years. And in fact, smoking rates had gone down in some schools because they'd said, we've made changes to the layout of the school. They used to go and smoke behind the bike sheds, and they can't do that anymore. So they don't smoke anymore. Now, it'd be very interesting to know whether the students would agree with that, or whether it's just the teachers don't know whether they're smoking. I don't know. But this issue around smoking and drugs not being a big problem was really contrasted to the issue of alcohol, which was mentioned by almost all of the teachers as a really concerning issue for them, for two reasons. The first one was about the age at which students are starting to drink, so it seemed to be getting younger and younger, and then also just the sheer quantities and volumes that they were consuming, particularly at the weekends, and the binge drinking culture that was out there. So they talked about students coming in on a Monday morning still recovering from a bad hangover that they'd had at the weekend. So they're very concerned about that. So those were the kind of main health topics that they brought up. They did talk about some other issues, but those were the ones that were most frequently talked about. So the next part of the interview was then really looking at this link between health and learning and saying to them, okay, well, do those health issues have an impact on students' ability to learn or your ability to teach them in the classroom? So I'm going to show you a series of quotes now from the teachers, because I think these illustrate the points that they were making very nicely. So first of all, we've got the issue around not eating breakfast. So this is a teacher describing the effects of that. And she says, you find that they're sluggish to get organised, they're slow to get started in a lesson, they make silly mistakes, spelling errors, things like that, that you just wouldn't see later on in the day once they've had something to eat and something to drink. So, really just basic functional skills that they were losing in the classroom and not being able to switch on and engage because they just hadn't had anything, to kickstart them in the morning. Energy drinks, this sounds like an absolute nightmare. You've got a kid who's downed a can of Red Bull or Monster at lunchtime, and then they come into the classroom and this teacher says, well, they're really hyperactive, they can't sit in their seat, they go and distract others, just really silly behaviour. They throw something across the room. One teacher mentioned about throwing chairs across the room, or they start a fight or something stupid like that. Now, one student would be enough, but if you've got 2 or 3 students who are like that, that's not just them not learning. Nobody's getting any learning done when the teacher's having to do crowd control rather than actually, getting on with the business of teaching them. Mental well-being, I think this one is, everybody can kind of understand this one quite easily. If you've got students who've got particular mental health issues going on, this teacher's saying, well, they're just simply not in the right place for learning, and they find it a struggle to even get through the school gates some days. And the last thing that they really want to do is pick up a pen and do their homework. It's just too many other things going on. It's not a priority, and their head's just not in the right space for it. And then this, I think, is possibly one of the most interesting ones. This was about sleep. Now, when we asked them about health topics, health issues in their students, they didn't mention sleep. This only came up when we said, how does health affect learning? So it was only something that came up when they started to talk about the impact in the classroom. So here's this teacher saying that she thinks that sleep is one of those things that actually has the biggest impact in the classroom, but it often goes unacknowledged. People don't stop and think, if this person's misbehaving or they can't concentrate, how many hours sleep did you get last night? And often when you do ask, you don't need to ask another question because it's obvious they only got 4 or 5 hours sleep. I don't know about you, but I certainly can't function very well on 4 or 5 hours sleep. And this was mentioned quite a lot by the teachers. Tended to be slightly more mentioned in relation to the boys about staying up gaming all night, but also the girls, engaging in social media and staying up on their iPhones or their computers all night and just simply not getting enough sleep, and then finding it very difficult to get up and then engage in school in the next day. So that's what the teachers said. So there's some crossover with what you've said in terms of the mental health issues. What we then decided to do was go and ask the students what they thought about this. So this wasn't actually a piece of research per se. This was a kind of consultation exercise, and it was part of the University of Bristol's Thinking Futures festival. So we went to a local school and ran 2 sessions with 13 to 16-year-olds and seeing what they thought of these issues. So we started off by doing a similar exercise to the one we've just given you. They had slightly more categories, and you can see them in this photograph here. They were given these different health topics and asked as a group to then come up with a kind of prioritise these and rank them. Now, there was obviously a bit of difference between the groups, but actually there were a couple of things that were quite consistent. So these are just a couple of examples for you. I don't know how well you can see that, but basically in almost every group, mental health and wellbeing was placed right at the top by the students. They were really concerned about that. The other interesting thing was that, again, a little bit of variation, but physical activity and nutrition was almost always put at the bottom. And the reason for that, when we asked them, was they said, well, we've had these messages rammed down our throats since we were at primary school. We know what we're supposed to be doing. It's boring. So actually, and then the second to top spots were kind of variously populated by sexual health or violence, bullying. So, but I thought it was really quite interesting that they were very consistent in terms of they wanted more done on mental health and less on 5 a day and all of that kind of stuff. So that was kind of an interesting topic to do with them. What we then did was get them to, we kind of gave them statements from the interviews with the teachers. So you can see the teacher was just saying, well, mental health definitely has an impact on how you could learn. And we got the students to line up on an imaginary line across the classroom according to whether they really agreed with that statement or they disagreed with it. So that this is kind of just pictorially representing where they were standing. And you can see that, basically all of the students were saying, yeah, of course it has an impact on how you learn. I mean, I think everyone gets that, don't they? So the next one was about skipping breakfast affects your ability to learn. You can see a lot more of a variation in answers there. And that seemed to be quite related to either whether or not you were a breakfast person. Some people just said, I can't eat breakfast in the morning. Another interesting comment was related to sleep again, and saying, well, if I have to have breakfast, I have to get up 15 minutes earlier and I'd rather stay in bed. So, there's a bit of a link there with the sleep issue as well. Again, this is energy drinks. You can see that, most of the students were saying, yes, energy drinks do have an impact on your behaviour and concentration. Some of them were disagreeing. and some of those were students who do drink energy drinks and saying it doesn't have an impact on me. And again, you wonder what their teachers might say about that. That may be true. I mean, equally, there were definitely some students who do drink energy drinks and saying, yes, it really does have an impact on me. So, you know, there was, again, a bit of variation there. And then the very final one we asked them was about sleep, and 100% agreement. Yes, of course, it has a massive impact. You know, when you're really tired, you just don't want to be at school, really, do you? You know, and that's very understandable. Okay, so I think bringing that all together, all of those three pieces of research, I think for me, it comes up with a really interesting story, because what it seems to be saying is that there's a bit of a gap between what the sort of academic research evidence is looking at and what teachers and students are telling us are most important to them. So, for example, you know, we've got half of our studies looking at physical activity and nutrition, but the students are saying, well, we're bored of this. You know, this isn't important to us. You know, equally, both the students and the teachers are saying mental health is a real issue, but we've only got 2 studies looking at that. And we didn't have any studies looking at sleep whatsoever. We also didn't have any studies looking at energy drinks or anything like that. We did have one study looking at consumption of breakfast, but it was in primary schools, not secondary schools. So it's kind of interesting that I think the research that we're doing out there, whilst it's good quality research and it's showing that it could potentially be quite effective, it's not necessarily hitting the right things. And equally, it's absolutely not looking at whether or not this stuff has an impact on behaviour in the classroom, attendance, attainment, all the kind of things that actually we really should be looking at within a school setting, and the kind of stuff that both the students and the teachers are saying, yes, these things do have an impact on how we learn. So I think, again, there's a lot of lessons for us as researchers in terms of thinking about what kind of outcomes and what kind of evidence we're looking for, and saying, actually, well, we do need to be looking at the educational side as well. And I think the reason why it's so nice to come and talk on this, you know, first webinar for the network is that I think actually the reason the network is really important, actually, because it does allow us to have that communication with schools and make sure that the research we are doing is relevant to you and is focusing on stuff that you actually think is important, because, you know, you're the ones who are at the coalface working with the students day to day, and you know a lot better than we do what are the current issues. So I think that's really why the setting up something like the network is really so important, and hopefully we'll be able to improve our research and make it more useful to you in the future.
That's fantastic. Well, thank you, Becky. That's really, I mean, it is really interesting. We'll pick up on the last bit about the School Health Research Network in a moment. But I think what we will do is ask Mike to open the microphones, and also so if any of you got any comments, questions that you'd like to put in the shared notes box. I just a couple of things. One is that the activities that you did, I just think would be really good activities to do in school, both perhaps with young people and with teachers. So we've written up those 2 activities, the one where you know, the different statements were being ranked by different groups, and then the way of getting the continuum of ideas. And so, you know, I could just imagine in a school that would be a really forceful sort of discussion to start with, and also maybe to link that with your data that we're providing in your school health research, in your school health reports. And so, just to reiterate that obviously energy drinks, we're providing information on the data from student survey to say, you know, about drinking energy drinks, and also sleep. And I've been trying to visit schools, and those are ones that they're finding particularly interesting to look at. So I think that'd be really good, as a starting point for that. So I don't know if there's anybody, if we've got any questions in the room, or some comments that anybody would like to share, because it's quite. Well, it's lovely to hear from you, because of course it just backs up the work that we think we're going to be doing here. I see that Hannah Littlecott, who is she's our first School Health Research Network research. She's been looking particularly with 3 schools and looking at different priorities, and she recognises that obviously emotional well-being, would be a priority. So that's good to know. So
all attendees are muted and may unmute themselves by pressing *6.
There were none from Wales. There was 1 from Scotland and 2 from England, but all 3 of those were in primary schools. So there is no evidence in secondary schools.
Mm-hmm.
So perfect opportunity to do some research there.
Yeah, that's interesting. So yes, Adam, I don't know if there's anything that you wanted to comment on or to say about work in schools.
So I suppose that the largest group of studies focused on physical activity and nutrition, and that also found that this approach was quite effective. So I just wondered if you could say a little bit more about what sort of things the review suggested schools could do to promote physical activity and better diet.
Yeah. So the physical activity ones, it's interesting again in that they tended to be in the primary schools. So again, I think it's a really interesting issue that a lot of the physical activity stuff is done and diet stuff is done in the primary schools, and then it kind of gets ignored in the secondary schools, when in fact we know that obesity doesn't go away in secondary schools, and in fact physical activity rates, particularly in teenage girls, decline massively. So I think that's kind of interesting. But in terms of what they were doing, the most successful things that they seemed to be doing was about changing the food that was available to making it healthier, to promote kind of fruit and vegetables, to put the salad bars first, that kind of stuff. And then also basically increasing kind of almost mandatory physical activity. So, having 10 minutes of physical activity in the classroom every hour or so, to making it, not an optional thing, but something that you just do as part of the school day, and it became embedded into the school. So those seems to be the most effective ways of improving that. But again, whether that's an easier thing to do in a primary school than a secondary school remains to be seen, because there's not a great deal of evidence out there.
Yes, I mean that would be interesting, and I suppose it's just looking at sort of different approaches. If young people are saying they're switched off a bit by work on physical activity and nutrition, maybe to look at different approaches,
different ways of doing it,
switch them back on. I mean, in Wales we are in a fantastic position because we've got the food in schools measure that has been introduced, where the food that's provided is, should be very, very healthy. So, it'd be a good sort of starting point if that's being found to be so successful. So, so there's some very interesting points, aren't there? I think in terms of, sort of where we go from here. Yes. So we have quite a few questions that have just come in. So I don't know if you can read it, but is it possible that researchers are looking at mental health and well-being, but these weren't picked up in the review because they weren't using a healthy schools approach?
I think that's absolutely the case. I mean, there is research out there on mental health, which some of which shows evidence of promise. But I think it's generally the view is that these kind of multi-level holistic approaches where you embed it into the school's practice are potentially more likely to be effective. So it's still interesting that although there is mental health work being done out there, it often tends to be quite curriculum based or very targeted. Going to the students who are very much at risk, whereas these are kind of a universal approach targeting the whole of the school. So it's interesting that that kind of whole school, changing the whole environment approach to mental health just hasn't been done. And again, maybe that's because it's a very difficult thing to do on a whole school, big setting, and we're not quite sure how to do that yet. That may be one of the reasons. But yeah, there is mental health evidence out there, but not taking this kind of very holistic approach.
So thank you. And then we have another question about do we need more multiple risk behaviour interventions, and what sort of approaches should these take? Do you think that's...
Yeah, that's
Case?
it's a good question. I mean, it's a little bit difficult to really say definitively from the evidence that we had from the review, because we had very small numbers of studies, really. Having said that, for the issues like substance use, so tobacco, alcohol, drugs, and then also violence and outcomes, the multiple risk behaviour interventions did seem to be pretty effective, actually, certainly more promising than the others, with the exception of tobacco. So the tobacco one, if you just focus on smoking, or if you do it as part of a multiple risk behaviour, it's pretty much the same. It's about as effective. But the other ones, it certainly looks promising, but there's not really quite enough evidence to be able to say, yes, we should be definitely going down that route, or no, we should be just focusing on one thing at a time. So it's a little bit unclear, but it's certainly, there's enough evidence to say it looks like a promising approach, and maybe we need a bit more research in the UK on that topic. Because that's the other thing to say about the multiple risk behaviour studies that were in this review. They were all from America. We didn't have any outside of America. So it's an approach that seems to be taken off there, but not being used as much elsewhere.
So what do you think, because obviously they're quite different educational settings and, very different sort of cultures. So do you think they would just, we could move those over, or is it a question of starting
well, no,
afresh?
I think that's a really good question. We've actually kind of had a few discussions with one of the research groups in America, but you're right, the educational setting is very different and the issues are very different, because one study in particular that I'm thinking of, some of the outcomes they're looking at about violence, but they're talking about, have you ever shot a gun at somebody? Have you ever stabbed anybody? Are you things that aren't necessarily quite as big on the agenda, thankfully, in the UK. Yes. So certainly, and a lot of them are also targeted at very much, very deprived inner city, often ethnic minority, African American groups. So obviously would need a lot of kind of tailoring to a UK context.
Those are all really interesting points. So perhaps at that stage, Becky, if I can thank you so much for coming. That has given us a lot of food for thought, and I'm sure it will for everybody. And perhaps we can, obviously we can take up a lot of this through the network. So if I just go on.
All attendees are muted.
Next slide, because I know there are people you need to thank, so those are on the slide and recorded. I just picking up from how Becky finished her presentation, and I just thought it'd be useful to put up two slides really. What is the School Health Research Network and what it aims to do? And I think it just takes on board really what Becky was saying. So it is a network. We know that secondary school is a critical time for young people's health, and so obviously it would be really good to look at what does work and to look at the research there. And with this evidence lacking, we need to be looking at how we can sort of generate more. But that's our aim. That's why we've set up the School Health Research Network, is it aims to improve the health and well-being of young people by increasing the quality, the quantity and relevance of school-based health improvement research in Wales. So, I think that's, hopefully we've sort of made the point that that's necessary. The sort of the longer term aims of the network, both to, so again, it just sort of picks up on some of those, but it's this long-term engagement between sort of schools and researchers, and we're providing, the first point, we're providing data to schools within your school student health reports, so that actually, we hope that will lead to a culture of school-led inquiry that we can pick up on and share with researchers, and obviously then to communicate research findings, which is, was one of the aims of this webinar. So what I'd like just to do for the last literally few minutes of the webinar is to just share the network news for the summer term. So it's a sort of verbal version of our newsletter. We've actually sent out our New Look newsletter this week. We got a few comments from teachers about just being so busy it was hard to read the whole newsletter. So what we've done is to put it in a different format. So this comes into the body of your email, and we hope that you will be able to check through all the things that we're offering and just more easily. It is also available to print out as well. So within that newsletter, these are just some of the highlights, and I just want to say that we had those of you who joined us in our launch event last summer. Can't quite believe it's a whole year ago nearly, in Cardiff. We had a wonderful time just making networks, meeting each other, and looking at developing things for the future. We found that so useful to be able to act on those comments and thoughts. So we're going to be doing, as requested by the staff that came, one in the north of Wales and one in the south of Wales. And we'd just love everybody, to send. We'd love to have representatives from all of the schools. It will be an opportunity. We've been trialling an e-survey, and we'll be able to give you some information, because obviously your next survey will be due, doing the survey in the autumn term, but then the report will be out in March. We hope it's going to be an opportunity for everybody to share what they've been doing. So that's a really important bit. And just to comment on this year's network activities, so that we can plan for the future. One little plea here is that if you can't come, we'd love to welcome another representative from your school. But what we would really like are a few short school presentations to show how the reports have either been used or are planning to be used. What schools have told us is that they think that the data and the report will be useful for healthy school planning, maybe involving their student voice groups, use within the curriculum, particularly PSC, the Welsh Baccalaureate, ICT has been mentioned, but lots of others as well. And then maybe going beyond, obviously to have staff involvement, but to go beyond the school gates and look at sort of parent involvement. So if you feel there's anything you would like to share with us, we'd love to know. So as always, if you just contact us on that email. And then just that's the last point I want to make really, is that all the learning from Becky's work that she's done is that it's a great opportunity to start to get involved in research, so that the research that's done is really pertinent for schools. So here's just your first opportunities. So one of the adopted research for the network is that seeing how we can help secondary schools choose health and wellbeing activities that research shows are most likely to work in practice. And that it's not a big commitment. It's looking at 2 staff interviews and a focus group. So if you feel that that's something you'd like to be involved with, then just register an interest with us. There's an opportunity for schools with year 12 and 13 if they'd like to be part of a sexual health project that's being run with 6th forms in schools, but also in colleges. And again, so if you want to register interest, that'd be wonderful. And then we know that Hannah's already working with 3 schools, but she's asking, and we've asked before, if it would be possible from representatives from each of the network schools to complete a short 15-minute online survey, and the links are in the newsletter. So and then just to reiterate, we'd love to hear from you. We'd really like to help. You are part of the network, so you can have a logo. You can use it on your website or on headed paper. So if you haven't had that, just let us know. We also have a sort of brief bilingual presentation you can use to inform students and other people about the network. So just be in touch. And finally, as I say at the beginning, we're just going to evaluate this, and it'd be really useful to get your views. I can't believe the timing. I'm really proud of that. Well done, Becky. So if in this screen will come a short evaluation, if you could just fill it in and send it back to us, and that would be fantastic. So thank you so much for joining us, and hopefully we'll be able to run some other events in the future. So thank you, and yes, okay, it should be with you very soon.